Hey, Dr. Lindsey here. Let me introduce this case, and this patient does live locally, so hopefully we'll get some follow-up over the next 12 to 18 months. This is a 40-year-old male to female transgender patient who wants her hairline feminized and advanced. And she's gone through a bunch of misery trying to get this hairline dealt with. I think she said she had 4 brow lifts, or reverse brow lifts, where the hairline's advanced. And 2 of them have been done, were supposedly by a very aggressive guy in our area. And all it's left her with is a pretty wide scar going into the temporal sideburns and down along the over the chewing muscles. And then a distinct, unnatural looking hairline across the front. So we'll do a strip case today and pack as much hair as we can into the scar. And we've had a pretty good track record of putting hair into scars. We cut the grafts a little chunkier, so there's a little more meat around the bottom of the root, and we make the holes just a little farther apart in the scar tissue. And then when we come across the brow in front in the forehead skin, we'll do it just like a regular hairline, except it'll be a feminized hairline. So this is what we do. I've got before pictures and 7-day pictures and videos from throughout different stages of the case. Everything went really well. The patient's got really thick, bristly, wiry hair, which helps cover. In addition, those thick, bristly, wiry hairs they're like big, bristly bushes. They have good root systems on them, so I would expect this to work. It'll just take a while because of the scar tissue. And she did a great job cleaning. She came a couple times during the week, and Wendy cleaned her up, and hopefully we'll get her back in a month for a scar check, and then it's 6, 12, and 18 months. So enjoy. Thanks. This person has had a number of brow lifts to try to advance this, not by me. It's still a fairly masculine hairline, so we're going to bring it down and try to get some hair in these scars. Going for her, she's got really good thick hair. Going against it, that's a lot of scar tissue. So we'll get this done today, and it'll take a good year, year and a half to get a final result given all that scar tissue. So now we've started numbing up the front, but you can look and see so much scar tissue from all these brow lifts. Here on this side, and across, and it's even worse on this side. So we'll try to get that hairline advanced downward and feminized. So there was a ton of scar tissue from all these brow procedures. So we packed grafts in there, or packed slits in there, and we just put the PRFM in. And now we'll place the hair. These guys over to the side are aimed down in the normal direction of downward hair. The rest of them are aimed in the usual
and that's down
radial fashion. Okay, so we've got this part done, and it turns out we have a little bit more hair than expected, which is good. And so we're going to go in a little farther into these lateral extensions of her brow lift and deal with that. And this should be a good result. It's thick, wiry hair and pretty well packed. So this is day 7. The stitches are just coming out, and that scar looks perfect. You did a great job keeping this thing clean. So put some vitamin E on it and take it in a month.
So you'll see right now the front looks perfect. What she did is she was putting vitamin E 3 times a day onto the recipient area. And that, you know how she has her hair is very, very thick.
Right.
And there was like a lot of crusties, but she started putting vitamin E.
Yep.
3 times a day, and that when she washed it, it helped to get rid of other. It looks really good.
And that is stuck in the scar.
That so, right there, it's look good, yeah.
Good. off that stuff.